Hello, joining us for the Fostering Success Michigan Life Domains webinar series. We're very excited to have all of you back and joining us today for our last webinar series, our last life domain in our webinar series. As you all know, my name is Maddie Day, and I am the Director of Outreach and Training with the Center for Fostering Success at Western Michigan University. And in my role, I directly oversee the Fostering Success Michigan statewide initiative. As usual, all attendees will be in listen-only mode. If you have questions or have any issues that are arising throughout the webinar, you can use the chat or questions feature in your sidebar. If you have technical difficulties, you can contact the Citrix team at the number that you see on your screen. This recording will be available following the webinar in our resource library on the FosteringSuccessMichigan.com website. Before we begin, we would like to say a special thank you to our funders, the Kresge Foundation, the Havermill Foundation, and Western Michigan University for their continued support of Fostering Success Michigan and the Fostering Success Michigan Network. And we would like to extend a special welcome to our guest expert today, Dave Zellmer, from a more support therapist from Ozone House. Hi, Dave. Thank you so much for joining us today.
Hi, thank you, Maddie. Thank you for having me.
Awesome. So today we're going to be discussing the physical and mental health domain. This webinar is great for young adults, students, professionals, and supportive adults. Frankly, this topic is something that if anybody is working with young people who've experienced foster care, this is a very prevalent and topic that you're likely to, to be addressing with those young adults. Throughout this webinar, we will provide an overview of the 7 life domains by Casey Family Programs. Then we'll do a deeper dive into the physical and mental health domain and really discuss why this domain is so important to the ongoing success and in particular academic and career success for young people with experience in foster care. We will highlight the work, and particularly today we'll be highlighting Dave's work in addressing physical and mental health, and then we're going to have some resources that Dave has shared for us. Of course, we welcome any questions or chat throughout this webinar broadcast. We will have some time at the end for Dave to answer those questions, so feel free to send any questions that you have throughout, and we will answer those at the end. So let's jump in. The 7 life domains is a framework that the Center for Fostering Success has adapted from the Casey Family Programs It's My Life framework. We've adapted it so that education is at the center, and the other 6 domains are organized around this. This 7 life domains framework provides a way for professionals, supportive adults, and young adults with experience in foster care to organize their understanding and develop a response to the complexity of their lived experience. The way that we view these is that all of these life domains are important to the ongoing success for a young person with experience in foster care. As we look toward the physical and mental health domain, here are just a few statistics that we want to provide you when we look at this issue and kind of look at this issue on a larger scale. So, as many of you know and understand throughout your work, there are many young people that have experience in foster care that live with a variety of physical and mental health issues. Roughly 50% of children in foster care have chronic medical problems, and over 50% of young adults, adolescents with experience in foster care show some socio-emotional or behavioral issues. Of course, post-traumatic stress is very common, and we probably see this in much of the work that we do with our young adults. Young people with experience in foster care are more likely than their peers to experience traumatic events, and really these are very much related to the issues that often have led to their being put into foster care. So things like abuse, neglect, community violence, constant transitions from home and school and between caregivers really just are a culminating series of events that often lead toward the experience of post-traumatic stress. Um, the other thing that we really see that kind of exacerbates the physical and mental health challenges that young people in and from foster care have are the high mobility. And so when we look at how frequently young people are moving prior to and then even throughout their foster care experience, we're seeing young people who are moving from caregiver to caregiver, from community to community, and this may cause multiple changes in medical providers. They, may receive sporadic health care. Their mental health care may also be sporadic or not addressed at all. Many young people go for far too long with undiagnosed and untreated medical and mental health issues. And then, of course, we know that physical and mental health issues are really exacerbated during times of stress. We are, at Fostering Success Michigan, spend a lot of time looking at, sort of larger factors of, adverse outcomes. And one of the spaces of research that has been most helpful in articulating this is the Adverse Childhood Experiences Study. For those of you that may not be familiar with this study, it's a very large longitudinal study that's looked at not just young people in foster care, but adults sort of all across the spectrum. And it really measures how traumatic childhood events lead to increased health risks later on in life. And so what we see is that there's a very strong correlation between the experience of foster care and the number of adverse childhood experiences. And of course, these adverse childhood experiences, or ACEs, as you may hear them being referred to, can contribute to physical and mental health issues throughout the young adulthood and adulthood for a young person. And these are really challenges that young people may not be necessarily aware of or really supported to address as they're moving from foster care and into that early stage of young adulthood. Lastly, we want to address the issue of psychotropic medication. This has kind of been a hot button issue for many advocates within the field of child welfare and those that support young adults with experience in foster care. We see that young people are really overprescribed psychotropic medication, and that nearly half of youth in care regularly take at least one psychotropic medication, and that these are often given at a very young age. And one of the things I just want to be cautious of saying is we're not saying that young people with experience in foster care should not be on psychotropic medication. Rather, we're just giving pause to the amount, the severity of these medications, and really what these medications are treating, and if there are potentially other, options, maybe, more holistic options to address the physical and mental health challenges, rather than just going directly to a prescription. That said, we absolutely support the use of medication as necessary and as determined with the young adult and the health and mental health professionals in their lives. In addition to all of these experiences that directly relate to kind of mental health, it's important to just really address some of the ongoing risk factors and challenges in kind of behavior and also health challenges that may come from earlier experiences of physical and mental health issues, and those experiences of abuse, trauma, neglect that are part of the experience of a young person who enters into foster care. So we see that young people with experience in foster care may have a risk of substance abuse use disorder. They may be more likely to engage in sexual risk-taking, which can result in higher rates of STDs and STIs and unintended pregnancy. And that one of the issues that we're seeing kind of come to light more recently, though I think those of us that have worked with young people for a long time have seen this for quite some time, is that young people in foster care are more likely to have endured sexual abuse or sexual exploitation. I think you could also put, human trafficking, really kind of capturing this, that we see young people in foster care very much being preyed upon by those who are seeking to engage in human trafficking, sex trafficking, and that of course lends to its own sort of other issues of physical and mental health issues that young people may end up contending with long term. There is fortunately some support that we have available. There's actually a lot of support, but something that is quite significant is the Affordable Care Act. Under the Affordable Care Act, there is an extension in Michigan. It's referred to as the Foster Care Transitional Medicaid extension, and this allows young people ages 18 through 26 to enroll in this extension of Medicaid. And we at Fostering Success Michigan have done a lot of work to help kind of create awareness about this. We have the toolkit on our website. We have contact information for Leslie Adams, who is our foster care transitional Medicaid specialist here in Michigan. And then we, of course, here have the link for the application for health coverage. So please feel free to get this information to the young adults that you're working with. It's especially important that we get this information to young adults who may have aged out or exited foster care several years ago, still fall under that age of 18 to 26 and that eligibility, but who may not be aware that they are eligible. So it's quite a significant resource for our young people with experience in foster care to support them as they're making their way through into education and career. So with that, I want to welcome Dave again and just say thank you so much to Dave for joining us today. Dave is here from Ozone House. Ozone House is a community-based nonprofit in Southeast Michigan. Ozone House has been a just wonderful partner with our campus-based support programs in the Southeast Michigan area, and we are thrilled to have Dave join us. So thank you, Dave. Thanks for joining us.
Thank you so much for having me.
Wonderful. So my first question for you today is to have you just tell us a little bit about the work that you do and the projects and programs that you have, and maybe even kind of broader to Ozone House in general, that support physical and mental health for young people with experience in foster care.
Yeah, absolutely. So maybe what I'll do is I'll first talk about some of Ozone House's general programs, and then I'll go more specifically into the more support program. So for people, just to kind of some background, so Ozone House is a nonprofit in Washtenaw County, Southeast Michigan, founded in 1969, and we provide a range of services. So we provide services specifically for youth who are homeless, have run away, or are at risk of those categories. And so we have a crisis line, a 24-hour crisis line. We have a drop-in center that can provide basic needs and a safe place to spend time. Can you hear me? Hello?
Yep, we can.
Oh, so the sound cut out. And then so we also have a range of counseling services. We have for younger youth, 10 to 17, we have non-residential counseling, but we also have a more intensive residential counseling program called Safe Stay, where youth can actually stay at Ozone House for 2 to 3 weeks and receive intensive counseling services aimed at reunification. So that's when the situation in the home gets to a point where maybe a break is needed for safety reasons, right? And then we're always working towards some safe, long-term, sustainable plan in terms of what would be after Ozone. We also have case management, so for thinking specifically for foster youth, maybe youth who have aged out of foster care in Washtenaw County, case management could be a great resource in helping them get connected with finding their own housing, looking for jobs, kind of working towards independence. We also have a transitional living program, Miller House, where youth can actually stay for up to 18 months, work with a case manager, and that's really prioritizing independent living, so really focusing on school and employment. So those are just, we have other services too, but let me get to the more support program because I know we're time limited. So the MORE program is a recent program that Ozone started in collaboration with Eastern Michigan University and Washtenaw Community College. And
Mm-hmm.
so what this program is doing is providing therapy services, emotional support services on campus. So we're actually on the campuses. We also can provide the services at Ozone House in the community if that's the student's preference. But this is a new program really aimed at supporting youth who have been in foster care and also youth who are either homeless or at risk of homelessness, either kind of getting them into college or helping support them as they're in college. So it's for either youth who are in college or college bound. And this was a program that just started up in October, so I'm very excited to be able to talk more about it and to answer any questions that people might have.
Awesome. Thank you so much for sharing that. I think it's a really exciting program, and I'm wondering if you could just maybe say a little bit about how the MORE program got started, how that came to be, because it's a really great kind of collaborative between community organization and I heard two of the campus-based support programs, and I think it might be something that sounds like in other spaces, across the state, and maybe for our out-of-state partners that people could look to replicate something like this. So if you just want to share a little bit about that, I think that'd be awesome.
Yeah, so I think in terms of how it came to be, there was a focus, I think this was either 2 or 3 years ago, it was a little bit more publicized. There was a student at, I believe, Eastern Michigan who was homeless and who was continuing through school despite that, and some support had been talked about. What could we do to support this student? And so kind of from one of those planning meetings, the collaboration I think started between Ozone House and then Kathy Stewart at REACH at WCC at Washtenaw Community College and Joy Rencher in Michigan. So these conversations started happening. What could we do? How could we partner a community agency that has experience working with youth with these on-campus academic support programs that are working with foster care youth and help support and provide therapy services maybe on campus? And so I think it started as kind of a collaboration talking about, well, what would that look like and how could this be put into action? And that's, I don't know if that answers your question, but that's kind of how it started. And I think this is something that has had great institution support in terms of from the education institutions. I've seen both at WCC and at Eastern that there's been a lot of support at the school level. I mean, just even having me there, and that's definitely felt great. And I think we've seen that in the results that it's been very successful. So yeah, so that's kind of how it started.
Awesome. Thank you so much for sharing that. And I think what I love about kind of how this got started was it really came from seeing an identified need, and then groups often are post-secondary, just often in general, post-secondary institutions can feel kind of isolated from community support, and maybe even isolated from each other, but this collaboration was able to happen because of the willingness to collaborate all the way around. So that's just fantastic to me. Can you say a little bit about how physical and mental health, and in your opinion and your experience, but how this is related to post-secondary access and success for young adults with experience in foster care?
Yeah, absolutely. So I think this is crucial. This is when we think about post-secondary education and how do people access that. Health and mental health, being at a place physically and emotionally to engage in that is critical. And so I think in thinking about access, so this program in particular, so it's for youth who are both college and college bound. And when I see the word access, thinking about, well, even just considering students who have just graduated high school, right? And so they have the summer to get through, and then they're going to start college in the fall. Well, what happens if they have an emotional crisis in the summer going into school, and now they're starting their their school year off in a mental health mindset where they're not prepared to be successful, right? So I think programs like this where we can address both ongoing support but also preventing things from getting to a place of crisis is so important. I think thinking too about this, making sure that youth know that this support is out there. So perhaps they don't currently need it, but knowing that once they get to school and now those stressors start piling up, and maybe they don't have that extended support network that some of the other students might have that they can turn to when they're overwhelmed. And so knowing that there are programs like this, whether it's the MORE program or programs like REACH or MAGIC, I think it's so important to supporting that success, the ongoing success throughout the college experience.
I really appreciate your perspective on that, and that you know, really looking at the very early on, before we even get to post-secondary, the post-secondary space, really considering what does it actually take for a young person to even arrive ready, college ready, ready to learn, right? And so, you know, speaking about that, trying to have some protective factors around that access pipeline to ensure that students are set up for success. And I also really appreciate that you talked about, you know, having these resources available provides, you know, a preventative approach rather than just, you know, responding in the moment of crisis, that young people are able to know, hey, even before it gets to crisis, there are these resources available. So thank you so much for sharing. You know, as I think about this domain, I think one of the challenges that we have, and probably similar to other domains, but I think in particular for folks who maybe aren't physical or mental health professionals, I think about, you know, what's the one thing that somebody can do to help improve outcomes for young adults with experience in foster care. You know, and so we look at this, our network is very diverse. We have educators, we have case managers, social workers, you know, housing specialists, all these different roles. And so I'm wondering if you have some thoughts about what, you know, what's maybe one thing, or maybe more than one thing, attendees could do to help improve outcomes for young people in this domain.
Yeah, I'm probably going to do more than one thing just because it's so hard. It's so hard to narrow it down. Well, I think from a professional standpoint, in terms of educating oneself, so being aware of, it's so important to be aware of what resources are out there, both internally at one's organization or place of work, but also externally in the community. What resources are available at the schools. And so being familiar with that, I think. So then once, if an issue is identified, you can provide appropriate referrals and connect those students with the appropriate support. So that's kind of I think like a to self-educating. But beyond that, I think it's so important for, and again, I think we had talked about, you had brought up the frequent transitions that a lot of these students have had, that have experienced, that have led to lack of continuity of care amongst their health and mental health care, perhaps. But that's also, in many times, has led to support networks that maybe are not as robust as some other students, right? So they may be a little bit more isolated. And so I think thinking about that as somebody, so paying attention if a student perhaps there's changes in mood, there's changes in attendance, there's changes in hygiene, that's happening for a reason. And so just being aware of that, and in a respectful way, checking in with them, asking them how they're doing, is everything okay? I noticed this, I noticed that. And if there is a relationship of trust, then maybe if there is something going on, that student will let the person know, and then they can be connected with the support. So it's the multiple things. One, being aware of what's out there support-wise, and then asking those questions. So if something is going on, you can help connect that student with support. And then beyond that, you brought up the Affordable Care Act. I think as social workers, as professionals advocating around resources, right, around what our government supports and invests in, because a lot of these things that are so critical to help support these youth to be successful are in danger of being cut. So it's really important, I think, as professionals, that we advocate when there are things that we know are needed.
Awesome. You know, I don't think if we could ask for kind of like a better list of 3 things. I was like, that's an excellent list, Dave, and I think we might even turn that into a list and just put it right on the webpage when we put up the webinar, because I think, so, you know, one, educating yourself, knowing the resources that are out there, knowing, you know, where you can make referrals. You know, for me, that really speaks to one of our core foundational beliefs as Fostering Success Michigan, where, you know, we really tell people all the time, you don't have to be the expert in everything, but we want to and we support you to be networked to other experts. And so, you know, it doesn't matter where you sit, you still can be connected to somebody who can support physical and mental health. I think the number 2 being, you know, paying attention to the students and the young adults around you, really looking and saying, you know, what might be going on with them, and do they need some extra support, you know, and then reaching out to them, you know, like you said, kind of checking in a really respectful way. And I think understanding that, you know, a check-in, you know, may need to be done in a way that is, you know, maybe a little bit more casual if you don't have a relationship with the student, but it may, you know, if you do have a relationship, maybe a little bit more intentional, a little bit more, you know, I think intentional about how you follow up with that student if you do have a stronger relationship with them. And then the last thing, something that I think we can all do, no matter what our engagement is with a young adult, is really support and advocate for the policies and the programs that directly impact our young people and directly provide the support for our young people. You mentioned, you know, the Affordable Care Act and the extension of foster care that is under that. You know, that's a huge one for this domain, and I think as we all, you know, seek to improve the outcomes for our young adults, people ask all the time, you know, how is education tied into health? And to me, you know, it's one and the same. And so if we believe that our young people should have improved education outcomes, we absolutely should believe that they have improved physical and mental health outcomes. So thank you for that list. It's excellent, and I think our listeners out there and other folks that come across this later on will probably see those and write those down and keep those on their desk. I hope they do. So now we're going to turn toward resources, and you know, this is one of those areas that I always love to hear from our experts on, because our experts just really are so immersed in their work, in their space, and you know, often provide resources that even as much as FSM is in the business of finding resources, we often don't have or haven't even thought about some of the resources that our experts share. So Dave, if you could go through the resources that you're sharing with us today and just kind of highlight, of course we have these links and we'll make those links available in the webinar toolkit, but just kind of let people know what they might find when they go and check out each of these resources, and maybe how you see these as valuable to the network.
Yeah, definitely. So maybe I'll just go through resource by resource and talk a little bit about each one.
Yeah.
So I tried to have a range of different resources, and as a caveat, some of these are very locally based. So what I would say is, you know, for people calling from not from Southeast or listening in not from Southeast Michigan, thinking about what resource might be similar near you in terms of that kind of agency or support. So the first one, the Corner Health System or Corner Health Center. This is a health center that Ozone House partners with. They're located in Ypsilanti, Michigan, and they provide very youth-friendly, youth-focused services. So this is a great resource for getting healthcare needs met, for psychiatric care, for mental health care in general. They have both therapists and psychiatrists there, so that's definitely something that that I utilize for all 3 of those things when needed. Community mental health. So again, this is something that each county generally has their own community mental health, and so that can be a great resource for a range of intensity of mental health supports, from individual and family therapy to medication management. I know a lot of community mental health programs are connected with a wraparound model for their counties, and so that can be a gateway to wraparound. So that would be, again, more on the emotional mental health support side. Crisis text line, and so Ozone House also does have a 24/7 youth crisis line, but I was thinking too about something that's a little bit more national. So crisis text line, and we know that young people, youth, are generally probably talking less on the phone and texting more, and so that's a resource where they can actually, if they're in crisis and need to chat with somebody, they can either text or chat. So that's another resource that could be accessed from anywhere. And then I also included so the different campus support programs, right? So Magic over at Eastern Michigan University, Reach at Washtenaw Community College, and University of Michigan, the Blaven Scholars Program. And so those are supports. So through more, I'm partnering with Magic and Reach, and so just different programs that are on campus they're providing that support for youth who have experienced foster care. That's a kind of academic mentoring, connecting them with having that person, the program director, the person there who runs the program, who can connect them with the different resources on campus and help navigate the school system, because as we know, as anybody who's gone to college knows, it can be overwhelming, right? Kind of familiarizing oneself with financial aid processes and just knowing who to go to when. So those are really critical programs and so important. And I added Pinterest as a resource, so both as a professional who might be looking, if you're looking for interventions for activities or worksheets. There's a lot of those on there, but also for individuals, there's lots of things around self-care, lots of really kind of cool inspirational quotes, lots of recipes if you're into cooking, different art projects. So just a lot of different things that can kind of tie into taking care of oneself you can find on there.
Awesome. I love, some of the things that to me are kind of like the out-of-the-box things, thinking about the crisis text line. That's awesome to know that that's out there, that that's not just for Michigan, that's something nationally folks can use, and really thinking about making sure that the resources are in the hands of our young people in an accessible way. So you're right. I couldn't tell you the last time that I talked to one of our undergraduate students on the phone, but I can definitely tell you that texting them, for sure within the last few days, absolutely. And then Pinterest, I love that. What a creative way to use that resource. It's something that is really accessible. Everybody's using it, and so for sure, why not use this for promoting healthy living, promoting some of those just kind of positive affirmations that can be helpful to have. I like the ideas, finding some self-care kind of ideas and some, maybe self-care recipes, healthy eating recipes, things that, are all part of really comprehensive self-care, but maybe just finding new ways to approach it, and also for those of us working alongside young adults, tapping into these resources where they might already be going and presenting it to them in a way that is a little bit more youth-friendly, less of like here's a checklist, do all these things, and more of something that is visual and that they would save and post to Facebook or share on Twitter, or even just download on their phone and kind of keep accessible. So thank you for sharing those resources. Again, I just think it's always so interesting to hear kind of the different ways that we can orient our support for young adults with experience in foster care. And here are some of the Pinterest kind of ideas that you have shared. And if anybody, if people are not familiar with Pinterest, hopefully this gives you a great idea of some of the things that you can find on Pinterest. There's all sorts of cool ways that you can search and browse. And I love, you know, so 12 natural remedies for anxiety that really work. Just, you know, kind of a quick list, something that, you know, you could send to a student, tweet to a student, put on their Facebook page, just let them know, hey, you know, thinking about you, you know, even just, you know, things that you can do self-care without spending money, all sorts of ideas. So thank you so much for sharing these. I think we'll probably look to find some and put them on FSM social media over the next couple days because I think they're really cool ideas. So our last question that we have for Dave, and this is always kind of my PSA to say, please send us your questions. If you are out there listening, you know, we want to hear from you. We want to, you know, hear kind of your thoughts, ideas, any, you know, questions that you have specifically about Dave and his work with Ozone House or the MORE program, the project that he's doing with Washtenaw and EMU. Feel free to send them using the chat feature or the questions feature. We'll have some time absolutely to get to those questions before we're done with the broadcast today. But before that, I would love for you, Dave, to share what we like to call a humble brag. So something that gets you excited, kind of gets you going, something, you know, within this domain of physical and mental health in which you work and support students with experience in foster care. What's something that you would like to share that's really cool, that's going on in your world?
Yeah, so I think one of the things that it's so inspiring when I hear students, when I hear youth talk about their mental health and their self-care and well-being openly, talking about going to, they say, I'm going to see my therapist now, and they say it in a very in a proud way, right? And it's not stigmatized, and seeing that in those spaces being supported is just, it's so amazing. And I really have to give a shout out to both Kathy Stewart and Joy Bencher. Kathy's over at Reach, and Joy is at Magic at Eastern Michigan. And so I think that speaks as well to the type of environment that they're fostering within their programs, where both health and mental health wellness can be talked about openly. So I think just in general, just that support, and also how the universities have came behind and supported this project from an administrative level. I'm just so happy about. So yeah, I'd say my humble brag would be my shout out to those two professionals, and then also just how this program has changed, at least in some way, how youth are talking about their mental, physical health.
Awesome. Thank you so much for sharing that. And we absolutely echo, you know, big shout out to Joy and to Kathy. You know, I think it was last year when they started talking about developing the grant and the pilot, and I remember thinking that is a really brilliant idea and a way to supplement some of the challenges that we see on college campuses. You know, often people will say, well, why do you need to work with outside partners? Don't college campuses have, you know, counseling centers or other types of support? And one of the issues that we have seen over and over again is there can be limitations through the number of visits, sessions that a young person's able to get. Sometimes young people they don't necessarily want to go to the counseling center on their campus because they're afraid of the stigma that might lead to. And some of the counseling centers, you know, really aren't trained to address the issues, the unique issues related to an experience of foster care. So it's just awesome, the work that you guys have done together. And I've heard nothing but great things about your partnership with them, Dave. And I also really appreciate you bringing up kind of the shift that you have heard in, you know, how young people speak to their own mental well-being and mental health care, that it doesn't have to be a shaming thing, that it is a positive way of taking care of oneself. And I think that we all should feel that way. And so it's great to see our young adults expressing that in a positive way. So with that, I am going to open us up for questions. Please feel free to send any questions that you have in. You can use the comments or questions feature in the control panel on the right side of your screen. We'll have a few minutes for questions, and then of course, if you have more specific questions that you want to follow up with Dave individually about, feel free. We'll have his contact information available at the end of the webinar. So one of the questions, as we're kind of waiting for people to write in their questions, one of the questions I had for you, Dave, is really around maybe some of the unique challenges that you see as far as addressing mental health for college-age students with experience in foster care. And I'm wondering if you could kind of share some of the maybe unique issues that seem to arise for young adults who are in college, engaged in college learning, that also have an experience in foster care. And then with maybe those unique issues, any ideas that you have about how the other professionals or supportive adults who are engaged in their life may be able to support those issues?
Yeah, so in terms of unique issues, I think, well, one, when we think about, and this kind of goes to access and to engaging in services, and so many of the youth who have been in foster care, they may have had negative experiences with therapy in the past. You had mentioned over medication. Sometimes there wasn't a choice about participating in therapy, right? So maybe they were forced to participate in therapy, and that was not experienced as a positive experience. And so, kind of building that trust and building that, getting them to a place where they're ready to engage in services, I think that could be potentially a unique issue. And so I think with this program, having it be on campus and having me work collaboratively with Reach and Magic and be there and having the youth get to know me before, maybe through attending a group that they have, that they get to see me and meet me and kind of experience, maybe this could be a different type of therapeutic relationship versus one in the past that didn't feel good. And so I think so building that trust in terms of unique issue and building that readiness to engage could be something unique. Also thinking about like support networks. So again, when I talked about that before, the support networks that some of these youth might be different than what other students have in terms of family supports, those types of supports. The support networks might be more friends. It might be only one family member or guardian. And so just kind of acknowledging that could be different. And so helping each student identify and build that healthy support network is a crucial part of care. And thinking about when you talk too about this goes back to past care, the continuity of care might have been compromised. So maybe there are health issues that haven't been addressed. So really, it's making sure that all of those domains are being met. So I'm a mental health professional. I'm a therapist. I'm not a doctor. So when there's medical issues, it's referring to, like as I mentioned, those resources, whether it's Corner Health or another health care provider in the area, getting them connected with specialists to address health issues. All of those things are so important.
Mm-hmm. I really appreciate you talking about kind of building that network capacity and sort of building the larger connections for the students. One of the things, we were at Eastern a couple weeks ago there for the housing domain, but one of the things that was really apparent was how much students really relied on each other for kind of sharing resources, learning about resources, and also normalizing the struggles that they were having. And I think that sometimes we underestimate, I think we put ourselves as professionals in that role of, needing to have all the answers or being the sole space of providing answers and connections to students. And really there's such a great opportunity, for us to help make peer-to-peer connections, and for those peer-to-peer connections for those to really drive a student's engagement within services. Because I think sometimes, it's just the normalizing space that that students need to then be willing to engage in a healthy way in mental health and physical health services and support. So thank you so much for bringing that up. So one of the questions, another question that has come up is really kind of this question about, if you have a student who is resistant to therapy, counseling services, how can you maybe work with them to help shift that thinking, maybe help engage them in mental health services and support. Of course, we don't ever want to force a student to do something that they're not comfortable doing, but maybe kind of shift their thinking around the engagement with that.
Yeah, and of course, the more programs voluntary. So ultimately, it's going to be up to the youth, to the student, if they want to engage or not. But this is something definitely that the resistance, or maybe not even resistance, but the apprehension, the caution around therapy. Is this going to be a good experience? Is this going to be a safe experience? And maybe there's concerns about that because of past experiences that youth has had. So in terms of how to help shift that thinking, I think, well, one thing in terms of my conversations I may have with students. So ultimately, they're going to decide, and so asking them what are their goals. So what are they wanting to accomplish, and do they feel like their emotional health or their mental health is making it where that's at, is making it more difficult to achieve those goals. So maybe kind of framing it in that way as a support that can help them be healthier overall and be more able on a day-to-day basis to meet the goals that they have set for themselves, because ultimately they're the ones that get to decide what are their goals and what kind of support do they want to access to achieve those goals. So I found that as a way that can be helpful, especially too if, and you brought up medication, I think medication is my personal or professional take on it is medication is a tool. So when someone has tried other things and that's not working, then as a professional, again, recommending maybe they talk to a psychiatrist to explore that option. And so that's kind of, once somebody's already in therapy, that would be part of the conversation if the mental health needs are at such a level that it's interfering with their ability to reach the goals they have set for themselves. So I think that's one way to kind of approach that conversation. I think just being a presence, being a consistent presence, and letting the students, the youth know that as a professional support you're there, and checking in with them. So being intentional about talking about their emotional health, and if there are concerns, pointing them out, like why you're concerned about their emotional health, and what it might mean for their success in terms of how they're doing in school. So I think those are some kind of more ways being intentional and consistent with those conversations.
Mm-hmm. I really appreciate you framing that around the goals that the students identify for themselves, and I think, and I like how that, even comes around with this conversation of medication, that it's really about, what are your goals, and, is there something getting in the way of you meeting those goals? Are there other resources, tools that we can tap into to help you move toward your goals? And I think that's really important. I think a lot of our young adults, when they have been in foster care, they actually haven't been in the driver's seat in many ways in their life. I would say in particular, I hear from a lot of young adults that they really haven't been able to make their own health or mental health decisions. And so as a young person is moving into young adulthood, and we are working with them to build more interdependent relationships, I think it's important to esteem that determination, and to really walk alongside with them as they make those decisions and continue to be a presence, like you said. And I think for those of us who are professionals and supportive adults, it may take some reminding ourselves that students will make decisions that we may disagree with, or we want them to make a different decision, but it's their decision to make, and that our role is really to be a consistent, supportive, positive presence in their life, not to tell them what to do. So, another question that I have is really speaks to the sort of larger space of advocacy. And, you're in the unique role of being a mental health professional. You've now entered into this role of a mental health professional who's working directly with students with experience in foster care on college campuses. So you have some unique insight into the resources that may or may not be available. And I'm curious for you, if there is, one thing, and maybe there's more than one, but one thing that advocates could really work to get behind, or something for those of us who are in an advocacy space, that we could help raise awareness, and maybe that's a policy, maybe that's a program, maybe it's a resource. I don't know, or maybe it's shifting some eligibility around, but what could be one thing that we as advocates can get behind to improve outcomes for young adults with physical and mental health? And maybe I would say this with the caveat of, in addition to staying engaged and alert to the conversation around the Affordable Care Act.
Yeah, definitely. So, of course, as you said, the Affordable Care Act, I think there's conversations going on about what will the public education system look like, and I think from an advocacy standpoint, supporting special education is critical. So when we're talking about students with physical and emotional and mental health needs, making sure there is that support in school starting from grade school, going all the way into college, making sure on the campuses that there's, disability resource support. But from an advocacy standpoint, I think where it can be targeted a little bit more is making sure that we're addressing that youth in school are receiving appropriate special education services when they need it. With some of the conversations that have gone on nationally, it's concerning in terms of what might be prioritized and what might lose funding. So we think about youth with special education needs, we think about homeless youth, or youth who are unstably housed. There are supports now for youth in those situations under McKinney-Vento. Making sure things like that are still around, I think, is so important. Because you talked about all those moves, the continuity, not just continuity of emotional and physical health care, but continuity of education, access to education is so important. And so there are resources now to help support that. I think advocating to make sure those resources remain is so important, because if they aren't there, a lot of these students are not going to be getting the support they need.
Yeah, thank you so much for that. I think to me, that really underscores this very close connection between physical and mental health and education. So as we look at our K-12 system and some of the changes that may or may not happen within that system, special education is an area that we know a lot of our young adults, young people in foster care are receiving services through special education services. And really wanting to ensure that those services continue, ensure that they remain robust, and that they are, funded to the point where they actually can be effective to reach the students that really desperately need them. That it doesn't become if you can afford it, then you can receive the services type of thing. And I think that for me, as I think about that, I think about that's part of the access piece. It's part of the college access piece as we think about setting young adults successfully up to post-secondary education. That really starts with giving them a high quality K through 12 education. And and for young adults that need additional services, those come through special education services. So thank you for raising that awareness, and I think definitely something that we can all be aware of, knowing that under the Every Student Succeeds Act, there will be shifts and changes. There already have been shifts and changes, separating out services for young people who experience homelessness and young people who experience foster care. And I know that here in Michigan, the Michigan Department of Health and Human Services is working very closely with the Michigan Department of Education around the implementation of foster care liaisons within the ISDs and foster care liaison coordinator within Michigan Department of Education. And so there are a lot of changes going on. I think we can all advocate for those changes to continue in a really positive direction for our young people. And if we don't see them moving in that positive direction, we can advocate that they stay on track. So thank you so much for raising that. I think that really kind of brings us to our time today. I want to say thank you so much, Dave, for joining us. Your insights were completely on point and just so valuable. I know I learned a lot. We will definitely be getting those resources up on our website. If you have questions for Dave, if you want to learn more about the MORE program, please feel free to reach out to Dave. This is his email address. We'll make sure that that's also available on our website. Again, it's a great project that is happening between Ozone House, Washtenaw Community College REACH program, and the Eastern Michigan University MAGIC program. So thank you so much, Dave, for joining us. And then just reminders that we have a couple other events happening, activities happening throughout the month of April, where we will continue our learning and discussion about the physical and mental health domain. So definitely please join us on April 12th. That is next Wednesday from 1 to 4 at Saginaw Valley State University. If you're not able to join us in person, we will have our panel, our student and professional panel, live streamed via Facebook Live and Periscope. And then, of course, we will have our Life Domains podcast featuring one of our students from our campus support program at SVSU, the FAST program, and that will be available at the end of April and focused on the physical and mental health domain. As always, all of our domains and our activities, our resources, and our events can be found on the FosteringSuccessMichigan.com website, and be sure that you are signed up for our newsletter to hear all the up-to-date information and kind of goings-on in the Fostering Success Michigan network. Thank you all so much. Just want to have one last shout out that we have a number of activities coming up in May for Foster Care Awareness Month. So here's just a quick snapshot of that. Be sure to check the FosteringSuccessMichigan.com website for all of these events to learn more, and then stay in touch via social media, where we will be sharing more information as we get closer to May and celebrating all of our amazing young adults who are in and have experienced foster care. Thank you so much to everybody once again for joining us for this Life Domains webinar. We look forward to hearing from you in the future. Take care.